Hi, Angie with Munlicka Healthcare here once again to talk about Z-Flows. If you saw the earlier video, we talked about how you have the adult small and how it uses zero flow and zero memory to both offload your patients as well as help position them. Now we are going to talk about the adult medium, your 16 inch by 30 inch, as well as your adult large, the 25 inch by 36 inch. Both of these can be great for holding lateral turns for your patients, as well as potentially offloading the sacrum and offloading heels as another alternative there. So first off, we will go with our patient here. We're going to show you the adult medium and use it to do a turn. So I'm going to take my patient here. Normally you would have another caregiver on the other side turning him, but we will make do here. We're going to go from his shoulder down to his waist. We're going to place that medium Z-Flo in there. And as he starts to turn back, we're going to mold and conform the Z-Flo to his body. Once he gets turned and positioned, we're going to take our draw sheet and tuck it in to really help hold and lock that Z-Flo in place. We got to keep his body in a nice neutral alignment here. We would adjust his head as needed. But we now have our patient in that 30-degree turn. So we're using this instead of wedges or pillows to create that turn. It's a lot more conforming and comfortable. It's really going to mold to him and help hold him in place. This can be used with the medium adult as well as that large adult, depending on the size of your patient. If they were going back to supine, we would easily pull this out. If you wanted to do a micro turn or micro shift, we could slightly adjust this just to turn him a little bit, or if he can't withstand a 30-degree turn, we could build it a little bit lower to create a smaller degree of turn. Another option with both the adult medium and adult large is for helping to offload the sacral area. So with this, again, we would start with it flat. Again, we would have some assistance here, but we would put it under your patient's thighs. Once we have that positioned, we would again mold and conform to his outside legs here. This is going to remove some of that pressure off of his sacral area and help redistribute pressure underneath there. Final option with this one, both the adult medium and large can also be used for floating the patient's heels. So instead of taking two small ones, you could use one of these larger ones. Again, the heels are going to come off the end. We're going to conform the outside parts of the Z-Flo to the patient's legs. You can build some up in between as well, but once again, we're floating the heels off the end. It's open on top, keeping it nice and cool for those patients and easier access for you. Once again, just a reminder, they are single patient use. They can follow your patient throughout the hospital and go home with them. For cleaning, just remember to wipe down with your disinfectant wipes.